so excited to show you the Heimann Cancer Center today. I asked my colleague Jennifer, who is a nurse navigator, to help us understand why this facility matters, not just on the big scale, but in the life of one person. And she gave me an example of a gentleman that she works with, and he had a cancer of the head and neck, which is a long course of treatment. And it's meaningful to me. I had a loved one who experienced that. During the course of his treatment, 16 visits with his medical oncologist, 9 radiation oncologist visits, 35 radiation treatments, 4 chemo infusions, 40 hydration infusions, 3 appointments to learn about his PICC line, how to care for it. He had a G-tube, a feeding tube, so there were multiple appointments to learn how to care for that. Visits with his dietitian, visits to the pharmacy, all of that, all of those things. Right now, 14 different locations all around our valley, 14. Cancer is hard enough, and so we can make it easier. You are making it easier, and this is the facility where that happens. Let's step into the lobby and I'll show you some really neat things here. So patients and families were at the heart of the planning of this process. We asked patients and the person who most often accompanied them to treatment to tell us, what are challenges you're experiencing? What's easy? What could we do better? And of course, that went to the feedback from our medical teams and leadership, knowing what medically needed to be in the facility. And then our design team, which included an oncology planner who's done hundreds of these all across the country. And they took that insight and came up with initial designs. And then we took it back to the patients and families and had them review and provide their feedback. And they gave very honest feedback because they knew what the experience was like. And so with their feedback, we have the design we have today. One of the challenges that people talk about is coming to their appointment and you arrive and you hear, "Oh, I'm so sorry, you're in the wrong place." That's never going to happen in this building. So we're here at the entrance off Doctors Park Drive. There's another entrance below off Barnett Road. And when you come in, the registration on either floor can check you into any appointment in the building, because no matter where you enter, you're in the right place. Now, one of the things we noticed right here in the lobby is the beautiful windows, and that's because one of the things we asked patients was, what do you want in your ideal environment? This is a place where you really want to feel healing and feel hope. And the things that reinforced that for patients were nature and art. And so nature and art are just infused throughout the building. So you can see here in the grand lobby space, all of these windows going up, and then there's this space here we call the lantern. Come take a look. And this art wall here, this art feature, is going to be based kind of an abstraction on the topography of the area. So you'll see represented in there the Table Rocks and the Rogue River. It's going to be very beautiful, illuminated a bit at night, so it's even kind of got a beacon sense to it. So we're here at registration. Right behind me is one of the places you can register in the building. Here on the second floor, it's primarily medical oncology. We're so excited that Hematology Oncology Associates for the first time will be in the facility with the other physicians, with all the best trained nurses, wonderful supportive service in the space. So if you're coming to see those physicians, check in here, and usually the first thing you do is go to labs. Let's go to labs. So before we go into the lab area, I just want to point out one space here. This little room behind me has a lot of heart. This is the sharing center. We often receive donations from people in the community who knit beautiful caps for people who are losing their hair during chemotherapy, or someone will go through treatment and they'll invest in this beautiful wig that hopefully they never have to wear again. And so they have those items, or durable goods, walkers, educational materials. They donate them to Asante, and here in the sharing center, those will all be available so that you can just take what you need, supported by your neighbors, and a little space where you can have a fitting for your wig, feel really comfortable and confident coming out. You can really feel philanthropy and the community just throughout this building, just really wrapping around people with cancer. Now we'll go to labs. Look at this. Look how far we've come. I mean, you could just see the steel, the studs last time we were here. Labs are right here on site, and we're standing inside of our lab draw area. There are 4 lab draw stations here and 2 private in the back for those of us who get a little woozy when they draw our blood. Those samples go right into this room here. This is the lab, and this is where those samples are processed. Our goal is to have patients come through, have their labs, and have their results in 17 minutes or less. And if you look into this room, you can see a doorway here. If we were to have a sample that required a closer look, there's a courier lane. The courier can come up right here, go to that door, pick up the sample, take it back to the hospital. They'll take a closer look, and again, your results are right here. So very efficient. I really appreciated in the planning process sitting in with a steering committee and hearing them talk about not just building a box where we would do things the same way, but really challenging the teams to think about how could we do things the best way for the patients. I pointed out a couple of rooms as we came through that are consult rooms that are used by our social worker and our nurse navigators, and there are spaces throughout the space where that supportive services team can interact with patients. And they are really on the front line of seeing what barriers patients are experiencing through their treatment. Life hasn't stopped for cancer, and that's where our Compassion Fund makes a difference. So donors in the community for several years now have been giving to the Compassion Fund. This really empowers those supportive services team members. They have funds that are quickly available to do things like put tires on the car for a family that's driving back and forth from the coast for treatment. Pay a month or two of rent or mortgage because you can't work. I'm incredibly grateful for that support. We're going to move back this way. We're going into some of the administrative and the staff spaces. Our teams are doing incredibly difficult work here, and so to be able to come into a room like this with a view or actually step out, this is a patio where they can sit and have some lunch, look at Roxanne, have some fresh air. The garden is open to anyone, and you'll just kind of see there's different nooks. There's a lot of light even in kind of the back of house space, which I think is really, well, the radiation oncologists have windows and they're extremely excited about that. This is office space, so this is where a lot of the administrative office team is going to be. The leadership for the program back here. About 2,000 people in our region are diagnosed with cancer every year, and we expect that to increase about 20% over the next 10 years. So we built this facility to serve that future community in mind. And this space, you'll notice, this part of the building is 2 floors, other sections are 3. But we're prepared here with footings and with additional steel above to go up if we need to, and so that we can expand much easier. So now we're moving into medical oncology. From where we were all the way out to the edge of the building, hematology oncology associates, we're so excited to have all the physicians in one place. This hallway right here, I want to point out, is actually what we call hotel space. And this is for visiting specialists. So keeping people close to home is so important. And for most types of cancer, the physicians you need are already right here. But if you need specialty care, those specialists can come and have office hours here. So again, down here, medical oncologists and exam rooms to really illustrate how involved the physicians were in the design of this space. It's been a couple of years ago now. I saw a sketch of the layout of the space done by one of the leading physicians who had kind of laid out what the ideal relationship between the physicians' offices and the patient rooms will be. So they're, again, kind of this neighborhood of care experience where the physician is at the end working in a neighborhood of patient exam rooms with the staff all right there, really efficient in terms of space for patients and for staff.
As you walk through, you saw the corridors with the 8 exam rooms. This is exactly the same setup, except for this whole thing is turned this direction. And the reason that that's done, why we did that, is so that we could continue to bring light from the windows down these corridors. And this right here is one of our conference rooms. This is just one of the 8-person ones. We got them different sizes so that you kind of do whatever you need to do in this building.
Look at this view. So from here, I mean, a wonderful view of the crane there and the new pavilion that's being constructed at Asante Rogue Regional. This is all part of the Asante Forward plan, the Asante Forward campaign. And very often when we're talking about the Cancer Care Initiative, people would say, what about kids? Children won't be cared for in this facility. Where they will be cared for are the top 2 floors of that structure over there, where there will be a new children's hospital within the hospital, and for the very first time, a dedicated infusion clinic to serve kids with cancer and other serious illnesses. For a long time, we had the only pediatric oncologist in the region. We're so fortunate now to have 2. So to be able to receive most of your care here is tremendous, and that is the case. Even if children have an illness where they need to work with a specialist at Dornbecker, they're getting most of their treatment here. And that really matters because we serve not only just this community right here, but 9 counties, more than 600,000 people all across Southern Oregon, Northern California. It's really going to make a difference. So I love to point that out. And for those of you in the neighborhood, you may have seen it lit up different colors before. Yeah. Very often if it's lit up a special color, it's for one of our kids in pediatrics. who has requested it, maybe for a birthday or a special occasion. This is the infusion area. This is oncological infusion, a significant increase from our current space. The chairs in here are arranged in pods, each with its own divider around it, about 80 square feet for the patient in their seat, and then a comfortable space for the person accompanying them to treatment, cubbies for your things. You know, patients may be in an infusion chair for 4 or 6 or 8 hours, and so it's very important that they be comfortable. And of course, in the process of asking patients what they wanted, we said, do you want, we didn't know if they wanted TVs or what, they reading material, but they wanted lightning fast Wi-Fi, which they will have, as well as charging ports on their chairs and all of these things so they can watch their shows on their tablets. And you cannot beat these views. And every seat here has a clear view of the mountains. And really importantly, every seat, the nurses here have a clear view of you. So if you have a reaction, they're right there to care for you. We have incredibly well-trained nurses in this facility. We know that that works because first we mocked up the space in a basement space in the hospital and tried that out to see how it was to move through the space. How did that work? We learned some things. And then we actually were fortunate to partner with our friends at Oregon Shakespeare Festival, who allowed us to use their scene shop and mock it up again, and then see what we could do there. And we learned a lot from that too. So in this space, also there are private infusion rooms in the back. I want to show you something really neat back here. What we're doing is we're building a home for cancer care. So this is the home. And you think about when you have a party and everybody hangs out in the kitchen. So we're in the kitchen right now. It's a space for families to come together, for people, you know, to get a bite to eat or get a cup of tea here. And of course, not heavy cooking because people are sensitive to smell during chemo, but just a place to linger and talk to others who are going through the same experience. Beautiful space here. This will be glass. This wall here with the skylight going all the way down has this really artful application where it starts from trees and mountains up to clouds and sky. Just again, light and art and nature throughout the space. One of the common themes when we talk about, or as we've been planning the Asante Forward project, so this facility, the expansion of the Spears Cancer Center in Grants Pass, the pavilion across the way, all of that, this idea again of having neighborhoods of care, having wherever you are surrounded by the people best trained to take care of you. People benefit from infusion who don't have cancer. And if you need an infusion, you want to be in this building because this is where the highest trained nurses and staff are to deliver infusion. But we wouldn't necessarily want you, if you, for instance, had a long-term infection that was being treated, to be over in the area of the facility where patients with cancer are being treated with their compromised immune systems. So instead, you'd come here to the general infusion area. It is very much the same concept as what you saw next door. So pods of seats facing out, beautiful view of the mountains here. Those nurses' eyes are on you for safety. There are private rooms across the back. This view extends. This roof here is a green roof, so planted with native plants, and that view just extends all the way out to the healing garden here. And there's a really good look at it if we go around the corner. And we're up in the lantern. Looking out, you can see this really beautiful art feature will be placed here, light coming through all around. And from here, a view out into the healing garden space. We thought it was important that people be able to walk out there and take a moment, catch a breath, make a phone call, or just recharge. And from here, where I'm standing, as you walk by, you'll be able to see the doorway that goes out. There'll be a patio there, and then a pathway that goes around with benches and trees, all planted just to really offer some reflective outdoor space. This is the waiting area where you would come if you were going to infusion next door. Community cancer centers like this one have an important role to play in cancer research. The cancer care program has been accredited by the Commission on Cancer for 56 years. And part of that accreditation is that we need to have patients participating in clinical trials. This space here behind me is our research conference room, where those teams that are beginning the clinical trials will start their work together and come together. There's space for our cancer research and registry teams here on the floor as they're tracking, a patient's experience over time. The pharmacy is right here on the third floor, preparing the chemotherapy that's delivered just down the hall. There are two labs here, negative and positive pressure depending on the agents that they're working with. All of that's prepared and then delivered really efficiently and to decrease the wait times there. There's also, though, a retail component to this pharmacy. So if you're having some symptoms, you need antihistamine, you need just an over-the-counter pain reliever, you can get that right here. And you don't have to make one more stop on the way home. It's one less thing. And that ease of your experience is really important to us. All right, let's come this way. I want to show you another space before we go downstairs. This is our fast track area, and this is for treatments that take 15 minutes or less. So if you need some hydration, if you need a dressing change, those kinds of things can happen right here. For those hydration infusion, there's no need for you to wait for a seat next door where people's treatments may take 4, 6, 8 hours. Come here, we'll take care of you, help you get stabilized and get back to life. And that's the point of the fast track station. So we're here on the first floor, and this is radiation oncology and advanced diagnostics. I love that even here in this space there's light coming in. It is very rare that our radiation oncology teams have windows, so we're glad to have that. And even as we're built partially into the hill where our healing garden is, there's really light coming through. I love that here on the garden level. We're going to go down the hallway and take a look at our advanced diagnostics area. There's a CT scanner here and a PET CT in this area. And at first there were 2 CTs in the plan, and then it became clear to us as we were looking at the planning that really there needed to be a PET CT. There's only one PET CT in the whole area. Right now it's up by the airport, so again, if you think of someone who struggles with transportation, to have it here really makes a difference. And we can't see now, but there are some really specific structural things that had to happen to have a PET CT. This is the control room where they can operate either device. When you receive a PET CT, you receive a radioactive isotope that goes into your body. There are waiting rooms here and bathrooms here that are specially built for patients having this procedure, because for the short time that that's active in your body, you're radioactive, and so we need to protect you and protect the space. And so you could see earlier in the building process, additional lead lining in these walls, also in the waiting areas next door, and the bathrooms and everything in this part of the facility. So the isotopes that are used for that are delivered every day from Portland. They're flown down, and they'll come on that service road that we saw. They'll come right here from this door right to the hot lab. So that's as far as they have to go, right into that space. Very efficient. So you can see here, this is the Barnett side entrance. Very similar layout to what you see above. You can pull in, pause here, let out your loved one. They can wait on the benches as you park the car if you like, and then come in together to this space. And now you're here in the first floor lobby. And this is a registration area right behind us, so no matter where you enter, you can check into any spot in the facility. Look at this.
Yeah, it looks great.
Doesn't it look beautiful?
Yeah.
So this conference room is such an important part of this building. It's used by the tumor board, which is a collaborative group of physicians that come together. So all different specialties, nurses, radiologists can come and weigh in on the most difficult cases and share insight and to have more collaborative care. And we know that there are better outcomes when you work with a collaborative care team. So the tumor board meets here, but when they're not using the space, it's also available for support groups, for classes. We see just unlimited opportunity to use this space. This wall here is one of the spaces where we will be recognizing philanthropy throughout the Cancer Center. It was really important to us that we had a variety of places where you could pause between appointments, whether that's some place where you need to get on your laptop and work, because again, life doesn't stop for cancer. So if your loved one's at treatment and you need to log on, you can do that here. Maybe you're the person in the family who is on the phone, you've just had your appointment, you've learned what's happening, and so you're going to call your sibling and you're going to tell them, well, this is what's happening, this is what's next. I appreciate so much the diversity of spaces here, Ron. Really thinking about how are people using this building. We talk about philanthropy and its impact on this cancer center. We used to talk about philanthropy, and I'll share this is I heard Scott Kelly say this, and I thought it was so well said, that philanthropy used to be kind of the icing on the cake. You know, it was the extra that we did. And now it's really baked into the cake. This whole facility relies on philanthropy. And in fact, this room here wouldn't have been on the floor plan if it wasn't for philanthropy. So this is our massage therapy studio. Massage therapy is available to patients for free because of philanthropy. You know, when you think of someone going through cancer care and they are not sure how they're going to pay for rent this month, they would never think of getting a massage. You know, that's so far. And so when our social workers, when our team are able to say, we have this for you, the community has provided this for you, it's incredibly moving. So it's moving and understanding that support as well as the physical outcomes of that care. So I love to point this out. This is another one of those spots where philanthropy, it's baked into the plan, and the community is just wrapping around you. We're going to go the back way into radiation oncology. So check this door out as you go in. The steel doors here, lead lining in the walls, additional very thick concrete here. 850 yards of concrete in the walls, 750 yards of concrete for the ceilings, steel linings. The ceilings are 6 feet in thickness in some places. This is all to protect the area above, because this is where radiation treatment takes place. And these vaults are really where this project began in a couple of ways. So one, as Ron shared, this was the first thing we built. You don't just drop these down later. So it started here with that. It's also conceptually where the project began, because the devices that we currently use to deliver radiation treatment, someday they'll reach the end of their lifespan. And when they do, we needed to be ready with new devices. Planning for that, there wasn't really a way to bring new devices into the existing space. So it became a conversation, well, what if? What if we build a new space? Well, what if we brought everyone together? What if? What if? And that's how the planning began and brought us here. We'll go next door and I'll tell you a little bit about the devices and why that matters to patient care. So the devices that will be in these two vaults will more than take care of our current volume of patients. And then there's a third vault that's for future technology. But the devices in this space are state-of-the-art. And they're able to operate on inoperable tumors by delivering radiation right to those tissues. And they are so precise, within a millimeter, that you're going just to the tissue you intend and not to the surrounding areas. And because they are so precise, then you can receive a higher dose of radiation. And the outcome of that is really decreasing treatment times. So we talked at the beginning about a patient coming, he had 35 radiation therapy treatments. And that's not uncommon to come for 5 or 6 weeks every day of the week for a treatment. With these new devices, what was 25 visits might be 5, might be 3, or it might be 1. And then you are more quickly back to life, back to healing, really going to transform the patient experience. And in this area too is the CT sim, where they essentially kind of pregame or plan the treatment that takes place in these vaults. So coming through here then, physicians' offices, radiation oncology, a conference space, exam rooms. Where we're standing right now is the cafe. So there's a cafe in this building that serves patients and staff, family members, and it's just right here. So this track you can see is where it closes up for the night. And then you can step outside as well and sit on this beautiful patio. This is another one of our named spaces, and you can sit and have a bite to eat and look outside. You can hardly stand here without talking about the Asante Employee RV Park. 80 of our families were unhoused in the fires. Asante invested significantly in taking care of employees. This space over here was Asante property. The city helped us quickly move through the permitting that we needed to do. It was prepared by Adroit, who's building this facility in the Spears Cancer Center expansion. Harry and David brought Christmas trees, just all of these really thoughtful things that were done along the way. There's gardens, and that actually was volunteered and done by the construction company that's working on the pavilion. Yeah. So the community really wrapping around healthcare workers here, and the generosity of this community is incredible.
I love to see the progress of this project because it's amazing. The thoughtfulness and care that went into it is what stands out to me still, despite the beauty. I mean, it's just kind and thoughtful. And I'm happy to be part of it. It's great.
I am pleasantly surprised with the amount of progress that's been made in the project. It's wonderful, wonderful to see. And the state of the art, almost everything in this building, not just the building, but the things that are in the building, it's going to be a wonderful place to receive treatment.
Incredible facility that the thoughtfulness and cooperation and coordination and philanthropy and everything that underlies it comes across monstrously well. I'm the spouse of a cancer survivor. Part of me says it would have been nice to have something like this when that was happening, but to have this available now is a step forward that the community desperately needed, and hopefully is the initial phase of other regional, collaborative, outstanding facilities that will come forward in the upcoming years. It was amazing.
Thank you. Thank you for supporting this project personally, with your philanthropy, with your volunteerism, with connections in the community. We were so fortunate to receive an extraordinary gift to name this facility from Mary and Dick Heimann, who often, would give anonymously, but allowed us to share that in order to inspire others. And often when you'll hear about a gift like that, you'll think, well, that's finished. We're not finished. We still have fundraising to do before the facility opens to complete construction. And the Heimanns did what they could. Many donors have done what they could. It's going to take all of us doing what we can to see this project through. So it's so important to just spread the word about what you've seen, consider how you can support it, and make those connections so people understand we're building a home for cancer care here. We're building hope. We're building a facility where incredible things are going to take place, and it's taking all of us to do it.